Good evening and namaste. Great pleasure to be with you today. And it's really, I think we should all congratulate Harsh for putting together such an exciting forum. They say it's lonely at the top. And I think each one of you who leads your business, your environments, must have many times feel that sense of isolation and wonder what can we do. And I think forums like these are really that bring you together and say we're co-travelers on a journey. But I think that if you look at entrepreneurship, everybody from what they show you in Shark Tank to what we're seeing here at Ascent, every entrepreneur has this extra energy level. It's like, it's different. It's different. And even in a professional environment, what you try to do is capture the entrepreneurial spirit of people to get the best out of them. So first of all, congratulations to all of you for being what you are, for building what you've built, and for aspiring to do what you do. It's in this aspect of aspiration, of building, of being something different, that I'm here to really share the Apollo story. And I know it's the end of the day and you've heard so much that it's interesting how I got slotted here, but I'm going to do this. I was asked to get rid of my slides and just share this story, and that's really what I'm planning to do. So in 1970, when most doctors were trying to go to the US, Dr. Reddy came back to India. Dr. Reddy was my father, and he came back to India, bringing with him 4 daughters, all who were too young to protest at leaving the US and coming back. And he said, that his father had told him, it's great hearing about all the work that you do in the US, but imagine how nice it would be to do something in India. And he set up what was then the best practice in Chennai. He had the latest equipment, the latest technology, and people started coming to him. But he was a cardiologist. And whenever he needed to do heart surgery, he would refer these patients to the US, because at that time, in 1972, 73, India didn't have a credible heart surgery program. In 78, one day he saved a young man, 38 years old, before he had enough time. He saved him from his MI, but when he referred him to the US for heart surgery, before he had enough time to raise the money and get his visa, this young man had the second attack and succumbed. Looking at his young wife and his 2 young children, Dr. Reddy said at that time, if Indian doctors can cure and heal people all over the world, why don't we give them the infrastructure to do so in our own country? And that really was the birth of the idea of building Apollo hospitals. So that was 1980. The maximum loan that a bank would give a nursing home was 5 lakhs. The bank balance that he had at that time was probably 25 lakhs. And the report which was put together by Ferguson and company said that he needed a minimum of 4 crores. So the process of changing the healthcare sector into an industry so that institutions would fund them, finding NRI money. So he traveled almost 27 trips to the US and to the Middle East to meet Indian doctors and say, hey guys, you're not coming back to India to serve your people. Why don't you invest $5,000? So one of the first concepts about tapping NRI funding happened in 1981 for Apollo hospitals. And so there was a series of firsts. And why am I sharing this with you? Whether it was changing the industry law, building, redesigning when India didn't have healthcare architects, finding a nursing director, finding professional hospital administration. You will find paths and ways to re-engineer, to recycle, to change the law if you have a vision and a passion and a need to serve. And that's really, I think, what entrepreneurship is all about. Every single one of them, from Elon Musk to the Tatas to her, everybody said, let me do something better. Let me deliver a better product. Let me find a way to do something different or fill a gap or serve a need. So I think the biggest thing that you encapsulate from all this is to recenter or to revisit your purpose for existence. And I think no one does that better. And then you go into the excitement that you had the very first day that you started your business. And I think Jeff Bezos of Amazon says it the best when he says every single day is day one. Every single day you go into your factory, your work site, your environment, your shop store, whatever it is, you say, you recapture that excitement that you had on the very first day. And you said, this is what I want to do, and this is how I'm going to do it. And whether you re-engineer your product, or you digitalize what you're doing, or you become omni-channel like was debated earlier, or you add that into your brick and mortar environment, but whatever it is, take to that passion of day one. And I think that's really a lot what Dad did. When we started the first hospital in '83, we really had a superb, outstanding cardiac program because that was what his first passion was. But he very quickly realized that the body is a complex and entire ecosystem. And this ecosystem needs the nephrologist. We got the best nephrologist from Bombay, Dr. M.K. Mani, to come back to Chennai. It needs an orthopedician. It needs critical care. So you build the infrastructure around that vision to serve. But then we realized that, there are no nurses. So we started a nursing school. There's inadequate doctor training. We started postgraduate training for doctors. There isn't the greatest technology. We built telemedicine. Rural India hasn't been served. We found ways to re-engineer the model. To date, over 27 of our hospitals are actually in Tier 3 and Tier 4 cities, small towns, so that we can find a way to serve these people. And partnering with the government, we have over 60,000 telemedicine connections. We're working with a different government to create primary healthcare centers, which is an EPHC. So there's a doctor, nurse, pharmacist, lab technician, small environment, but every single consult is being monitored by a clinical decision support system, which is backed by artificial intelligence. In this very same room last evening, we won the prize for the artificial intelligence best use of AI for a social cause. So it's hundreds of things that you will do when you have that purpose in mind. And that purpose sometimes grows. What started as find a way to bring credible heart surgery to India, today that purpose is find a way to bring healthcare of advanced standards within the reach of Indians. So this is access, geographic access. So we build or we share our models with others to do it. Financial access. So we were the first organization in 1987 to create a foundation called Apollo Health Association, whose sole purpose was to push legislation for health insurance in this country. Can you imagine how many of you, either you or your family members, over the last 5 years have had a health problem which was not where you did not use insurance? There's no one, or maybe one person. When we started, 97% of our patients paid out of pocket. And we know what it feels like because we saw people who sold their land or pawned their wife's jewelry to pay the hospital bills. And we know that nowhere else in the world do people pay out of pocket for healthcare. You need insurance coverage. So we started the association, we legislated with the government, we pushed for insurance. And India is uniquely one of the only countries where not only do we have a health insurance sector, but health is in general insurance and health is also attached to life insurance. We requested for that because we said people who come from a life insurance background will look at healthcare from a long-term perspective. They will invest in giving their clients a mammogram for 2,000, 3,000 rupees, which may even be the cost of the premium, because if you pick up one person with a lump and you treat it at the stage of a lump, you will avert the crisis of having stage 3 cancer and ultimately losing your client, individual, or that human being. So the whole thought process gets re-engineered again when you have a passion. Moving to the next aspect from passion, I think because we've been in business, we're, locations, multi-business, we do pharmacy, retail, education, all kinds of things, but we've been in service for the last 35 years. And I think that entrepreneurship, one thing that is there about it is that once you're an entrepreneur, you're always an entrepreneur. You're going to keep on finding things to do. You may exit a business. 8 years ago, I sold my healthcare IT company. It was India's first health BPO. We sold that company because its relevance to India and the market we were doing and the ecosystem we were building was less. But we took those learnings and put it back in here. But over the last 35 years, we've built many of these new businesses. And I think what you will see is an evolution of your model. Today, we're beginning to see about 5% of our consults are teleconsults. People download Ask Apollo, they sit at home, and they're able to have a consult. Who would have imagined that 10 years ago? So whether you're in a brick and mortar, as Mr. Biani was saying, or whether you're online, I think the delivery mechanism is secondary to the aspect that you're focusing on the consumer, the client, the individual who you're serving. And once you're centered around that purpose, that let me find a way to bring whatever I want to this person, and then you go deeper and say, let me understand what this individual wants and find a way to serve them. I think that's really the transformation. And in that process of staging of a business, because you're all entrepreneurs, each environment goes through a cycle. Whether it's you yourself, and then who are the professionals you bring in, or partners, or family members. What is the skill sets and talents that you need and that the market is demanding? Who are you competing with and how are you evolving? So these, I think, were things that continued, and my father, Dr. Reddy, he has no MBA, he didn't study, but I somehow feel that a combination of good practical guidance and the ability to bring in the right professionals or advisors to add on to the knowledge that you have is a very important and winning formula. And in today's world, I believe it's far more important than it was in that day and age. And I remember that when we got into the business, and we are 4 girls, he had 4 daughters, and I think all of us were some way very determined to do a good job of helping him, because we grew up hearing this thing of poor Dr. Reddy, he has 4 daughters. And we were very committed to say, we want to make sure that people say, lucky Dr. Reddy, he has 4 daughters. And thank you. Thank you. So it was a matter of going in there and understanding what he was looking at, what he wanted to do, and then finding your space or your niche. So any of you, and I believe the audience here is from 21 to 60 years old, so whether you're a young person getting into the family business, or you're an elder inducting your children into the business, I think it's very important to understand, 1 is aspirations, 2 is skill sets, capability, and beyond those 2 is aptitudes. People have aptitudes for things. So if you look at my 4 sisters, or 4 of us, my 3 sisters, each one of us has a fairly different skill set and are fairly complementary. Sunita, who's the second, is the financial brain. She's the numbers person. She went, 10 years into working, she went to Harvard and studied finance and business because she said, this is what I'm going to do for the company. Preeta and I hate numbers. We love people. We can work with doctors, we can work with patients, we can do this. Shobna is a born leader, she will innovate, she will lead. So this ability to find skill sets, give challenges, structure the environment so that you have little successes. And little successes build confidence, and from confidence builds capability. So each of these are a journey. And some of these journeys happen subconsciously because you're busy at work and it's just evolving. And sometimes you have the luxury to step back and say, hey, what can we do better? What can we do together, and how can we do it? So whoever is your team, whether it's your family or your professionals, I think one of the strongest things which happened to us is this ability to say that once a year we will step back. And large multinationals do it, very nicely, take the whole team to Goa, run one structured program, the whole story. But I think entrepreneurship and small businesses and MSME is the backbone of India. So the principle and the ideology of being able to step back, appreciate what each other's talents are, figure out what's happening in the market, where are we, where are they, and what's the competitive environment, I think that's been something which helped us it's what drove us to rethink our model. Because when we started in 1983, there was no one else. Within 7 months of our opening, all 200 beds were full. And for 25 years after that, at the hospital division, we did nothing else but growth. More beds, more growth, more beds. But each time we began to realize that the environment was changing. And when we looked at the competitive landscape about 10 years ago, we started looking at a shift in the model. And this shift in the model was driven by many things. One was really by the deep belief that customers and the environment are creating a shift in the way people access healthcare. So today we realize that hospitals are not the be-all and end-all of healthcare. Hospitals are appropriate for advanced sick care. And healthcare is moving from the hospital to the clinic, from the clinic to the home, and from the home to a 24/7 ubiquitous access to care. And therefore, we open clinics, we open specialty formats, we did day surgery center, we did Cradle, which is our women's birthing center. We added a home care company, and we strengthened our telemedicine and our digital capability so that, like I told you today, now we have about 5% of our consults don't happen in the hospital or the clinic or at home, but actually happen in the individual's home with the doctor being wherever he needs to be. And it's that ability to step back which helps you understand this environment, that ability to partner with professionals which helps you learn the skill sets that you don't have, and finally, what keeps you going at this is that commitment or that passion to say, let me continue to find a way to serve the customer. And taking off on a very interesting point that Mr. Biani said was that, it's not about omni-channel, it's not about brick and mortar, it's not about individuals, it's about ecosystems. I think that in healthcare, the first play was really put the big technology and bring in the machines to help the doctors. So whether we took the heart-lung machine and did the best in bypass surgery, or we took the minimally invasive laparoscopic techniques and were able to reduce the scar for the patient and the suffering for the patient, or in cancer. So you take TrueBeam, and in few months at Apollo, we will be launching Asia's first proton therapy machine, which is the most advanced for treatment of cancer. So technology brings a piece, but we said that piece or that treatment is not enough. You need to go from product to looking at a service or an environment or a platform. So now you can teleconsult, you can ask for a tumor board so that 4 specialists will give you input on your treatment. You can have a personal health record so that you track where you are in your healthcare. And finally, you can take all that and get a second opinion internationally, or you can look at your genetic profile or makeup and say, does this treatment suit me? So these are going from just the machine to an individual, personalized, time-appropriate, stage-appropriate solution pattern for the person, which encompasses him. But even with this and trying to push this at the same time, I think Dad and all of us kept saying, what's more? Where are we going? And one of the things that when you work in hospitals, you get very close to seeing what it is. We don't do corporate offices. All our offices are within the building of the hospital so that all our teams walk through the hospital environment. They're seeing what's happening. They're greeting nurses. They're close to doctors. So we said, there's something more in this. So we have to move from product to this service ecosystem to finally solutioning. And in a solution environment, what could we do? And we looked at our patients, we looked across the ecosystem, and the sad fact is that in India, patients come late. So when we treat cardiac problems, we very rarely treat a single vessel. You will see 3 vessel, 4 vessel. How many of you know that 3 vessels stented, 5 vessel done surgery? When they come with cancer, 62% of Indian patients come at stage 3 and 4. 74% of patients in the US come in stage 1 and 2. Early detection leads for better diagnosis, less painful treatment, and far, far better outcomes. So we said what we're looking at is not just this solution, this platform, this treatment, this outcomes. We do it very well. We'll continue to do it well. We've built the ACE, which is Apollo Clinical Excellence Model, and we will continue to run that. But what more? And so it was in one of these offsites, and incidentally, the offsite was being run in Chittoor, which is our village, where we run a program called Total Health, where we're trying to create an environment from birth through life for people. So clean drinking water, sanitation, women's employment, nutrition, maternal health, and screening, diabetes, the whole story. And we were there in that village environment. There were 17 of us, and we're trying to say what more, what next. And we said we will move from product to ecosystem to actually solution. And what really is the solution that a hospital seeks? The hospital seeks the solution that the individual seeks, which is prevention. And suddenly one small department in every hospital of ours is the health checkup department. This preventive healthcare has become the hero for the last 6 years of our existence, that we are pushing more and more to say, please come in early. Come in when you're well. Do that preventive health checkup so we find these problems. And it was based on the 70,000 patients records. We actually have 18 million health checkup patients, but in well digitalized is about 80,000. But based on that we built the cardiac AI model for risk prediction that we won the award for yesterday. So basically what we're trying to do is transform or add a whole new dimension into our care, which is come into the homes, empower individuals with knowledge, focus on health checkups, prevention and early detection. So we're screening. We've now put a model in partnership with Samsung, which is a bus which can go to corporates and to neighborhoods to quickly test. We're working on a venture fund to look at early detection because your mobile phone is soon going to become your health lab. We're looking at methodologies where the echocardiogram, which is a fairly complex test, or the ECG, is going to become that small. So we're looking at a partnership again, so we add it onto the mobile phone and make it accessible, because we currently are in 400 corporates with our health check program and our health clinics, and we'll add these devices in. So the transformation with technology, accessibility of bringing care closer to the individual are all very powerful aspects of this new age of healthcare. But I know that you don't want to talk only about healthcare. But I will end my healthcare saga with just one thing, and that is that health is, I think, the subject which is most close to every individual. And I should not step off the stage before I tell each one of you that before you can conquer every milestone of business that you want to, before you can be the greatest moms that I know you're trying to, or be the greatest family people, you need to find a way to take care of yourselves first. And that focus on yourself, whether it is the marathon running that Milind told you about, or yoga and everything else that so many people have discovered internally for themselves, it's important to bring that best into you, because actually the human body is a super amazing and complex environment. When you run, you release endorphins. When you exercise, you release endorphins. You all know that. When you're appreciated, whichever way, you release serotonin, which is another positive hormone. But very few of you know that when you're stressed, when you're unhappy, when you're upset, the normal reaction of the body is what is called fight. And when you fight, it releases adrenaline. In the downside of that circle of adrenaline, you start releasing cortisol. When you release cortisol, it promotes the deposition of abdominal fat, because thousands of years ago, when the human body or civilization was in stress or problem, their primary stress was starvation. If they weren't running away from a tiger, they were going to be starving. So the body learned to store fat. That mechanism still exists in every single one of us. So when you're stressed, you begin to store fat. When you store fat, you're becoming a precursor for diabetes and all the rest of it. The simple end of this physiology lesson is, please learn to de-stress. It's very, very important. Because you can conquer the world, you can, you went to 100 crores, you'll go to 200 crores, or maybe it's 50 crores. That 50 crores is more powerful than the 50,000 crores that Kishore Biyani is doing. You will always be chasing a milestone. Your son came fourth in class, you want him to come first, somebody got something in GMAT. The world is structured in the most competitive manner possible. Whether it's the media who's asking you, are you number 1 or 2, and you can achieve. But there's a greatest power in achieving in a de-stressed environment. And that de-stress will come from this focus and balance. So, and what brings you focus or balance? And the simple ones, people will say, I listen to music, I do this, I do that. But do we do it enough? And do we do it in a manner that simply says, the only companion I have for my whole life is my body, exactly. So it's not your wife, it's not your corporate, it's not your child, it is your body. So please realize that life is priceless. And each one of you are contributing to your companies, your families, to your employees, to their livelihood, to the nation, to the world. But take care of yourselves. And finally, I feel very passionately, besides health, about the aspect that all of us are contributing, not just to the bottom line or to the social good, but to the triple bottom line. And the third one, besides the fiscal responsibility and the social responsibility, is really the environmental responsibility. In India, with our population, with our poor methodologies, whether it's garbage or chemical or, the air pollution, it's important for every educated individual to stand up and become more environmentally conscious, because otherwise you may end up giving your grandchildren a lot of financial wealth, but you won't give them a world to live in comfortably. So let's look at the triple bottom line. Let me end by really just congratulating all of you on the tremendous work, congratulating Harsh for creating this platform and this forum, and quickly seeing if I have anything else to say. But let me actually end by saying this one. Yesterday I was in Delhi, and a FICCI delegation of 7 of us went to meet the Prime Minister. And Harsh was actually supposed to be with us, but I think he was organizing this session, so he didn't come. And what was supposed to be a 20-minute session became a 1.5-hour session with the Prime Minister. We covered everything from GST to tourism to the trade deficits and the dollar price and MSME and how he's not doing a good job about promoting MSME, and he spoke about his new policy. But finally, actually, when we spoke about tourism, he brought up something. And what he said was, do you all know that we built this statue of Sardar Patel? And we said, very big, world's biggest statue, we know it. And he said, how many of you have visited it? And all of us looked down, none of us had. And he said that, when the ideology is about unity, of bringing together, of recognizing someone who helped the country stay together, what is corporate India and what are people doing for us? And I think it's really become the time where the country is calling us. So the Statue of Unity is just one small point to say we need to be proud about our country, we need to be proud about his ideologies. But I was very moved when he actually said that corporate India should take nationalism to a new level. I know we use the colors, I know we talk about it, but I think there's beyond that. So let's look at what can we do as nationalists. So beyond the customer centricity and beyond the social impact, and beyond our personal health and what we do for ourselves, I think the time has come to look at the environment and the country. So with that, I will say namaste and thank you very much.